So what does it mean now that Bobby Kennedy is taking over the Department of Health and Human Services?
We're going to give you our take on what he could do.
In fact, we will give you our top 3 strategies if we were him. Let's be real. So many of us want to get healthier. There's so much corruption. Enhance the health, which it hasn't. Lengthen life, which it hasn't. And reduce illness and disability, which it hasn't.
All these things in place that's supposed to, be spending money on healthcare.
Big pharma, the big food, the medical system. What I've been told was all a lie. That he wants the chronic disease, get back to real science-based evidence and end that corruption.
Right.
The U.S. has the lowest life expectancy of pretty much all of the modern day countries of the world.
Oh yeah, we have the lowest life expectancy, yet we spend the most money.
We do. I mean, we spend about 18% of our GDP, about 1.5 trillion with a T, dollars every single year on just health.
Yeah, you were telling me the other day, like the life expectancy in 1980 was what?
Like 73.7 years.
And now what is it today?
Well, 2022 it was 68 years, and my understanding is that's still ticking down. So yeah, so we have lost 5 years on our lives expectancy.
Yeah, but yet we have all these things in place that's supposed to be spending money on healthcare.
Yeah, supposed to be healthier, better medical treatment, better healthcare, et cetera. But the problem is that there's so much corruption. Right, and from the big pharma, the big food, the medical system, because their job is to end chronic disease, end childhood diseases. But all of these things have gone up, things we have seen today that we haven't seen when we grew up.
Seriously.
Right. And that's what his mandate truly comes down to, is that he wants to end this chronic disease.
Yes.
Right. His 3 mandates: end chronic disease, childhood chronic disease as well, get back to real science-based evidence, and end that corruption.
Right.
Those are the 3 main things.
How you think he's going to do that?
Well,
would you do it, I should say?
Well, it's going to be very difficult, first of all, because he's already getting so much pushback. Yeah. There's been rumors that like big pharma, when his name dropped, having big meetings together, trying to figure out what is going to happen, how they're going to attack it. So there's pushback from the major food companies, the chemical companies, the pharmaceutical, even probably the 3-letter agencies, of the government.
Agencies.
Yeah, they're all trying to figure, okay, wow, what's going to happen when he comes in, and what's he going to do? Because he has a whole different set of health initiatives, which I think are in good intention, that they're probably not ready for.
Well, they're going to lose their revenue stream. That's what it boils down to, right?
It's money and power. It's definitely money and power. I mean, it's going to be difficult for him to carry out the new programs, but that's what he's going to have to do, have new policies and different programs in place to tackle those big 3 initiatives that he has. And quite frankly, I just feel that the public has been lied to for so long. I know once I woke up, I realized what I've been told was all a lie when it comes to food, from the vegan foods, the green lies, high fat diets, high protein diets, all this stuff. I just been lied to, how this drug is good for you, this drug is good for you. My dental training, I can go on and on and on, but yet there's this thing called like Stockholm syndrome, where you just keep going back to people who mistrust you or who mistreated you, because you keep trusting them over and over and over again. That's how I feel like the people of the United States are. Like, oh, we forget about the COVID crisis, but no, we're going to keep coming back to you. Oh, by the way, you were a big pharma, but I didn't like you 20 years ago, but now I love you. I'm going to keep on going back to you. You know what I mean? So there's a lot of corruption out there, and that needs to be fixed.
Okay. So how you go about fixing it?
Well, I mean, let's start with the FDA.
Okay.
I mean, the FDA is very corrupt. I mean, 75% of the funding comes from big pharma.
Wow.
Yeah. And there's, I think, about 14 members of the board of directors, I believe. Hopefully my numbers are correct. However, of the board of directors, there are the commissioners, and 9 of the last 10 have gone to go work for big pharma afterwards.
So that's pretty much all.
Well, I mean, think about it. So I'm on FDA. I want to make policies, if I know I'm going to go work for big pharma, that will benefit me in the future.
Wow.
That's a conflict of interest. That's
That
corrupt.
is a very big conflict of interest that they don't have the general public's interest in mind. Right?
Another one is the CDC.
Okay.
I mean, their job is to protect health through health promotion, prevention of disease, injury, and disability,
Okay.
and prepare for any kind of new health threats. That's their job. It's really to analyze information, to say, hey, this is a trend. Here's the things we can do, and not really tell you what to do. But that mandate has completely changed where they're telling people what to do. Right, they're actually telling people what they can. You can't rent out you can't kick people out of your apartments if they don't pay rent. And they're doing all that stuff during the COVID crisis. So yeah, they got to get back to their mandate and their mission, and that's going to take a hard change when it comes to culture, policy, and procedures.
Okay. Okay.
There's the NIH. Their mission is really to apply the knowledge, all right, the application of knowledge to enhance the health, which it hasn't over the past 20 years, lengthen life, which it hasn't over the past 20 years, and reduce illness and disability, which it hasn't over the past 20 years. So they got to get back to fulfilling their mission, and that's going to be a hard thing. However, doing the things I think we're about to suggest, I think it's possible. They got to get the money out of them funding the school grants. They got to get their claws out of having patches on drugs, and they promote those type of drugs because, again, that leads to corruption and just not doing what's best for the people.
You think there'll always be loopholes where these people can come in and will have corruption?
Well, I don't know about always. I hate using the word always.
Yeah.
It's going to be a tough thing to break down because once people have power, they don't want to give it up.
Right.
And then
so
they're
there should
going
always
to
be
fight.
transparency.
Yeah, I think it's one of the ways to go about doing it. Yeah.
Okay. So let's go through this list now. So
Okay.
what is the first thing?
Well, the first thing I think in order to lower the chronic disease, one of his mandates is the food.
Okay. Definitely.
Food.
I'm a big proponent of that.
Yeah, get more locally grown. Get away from the whole processed foods, the sugars, the acetos, the GMOs. Get to more of the organic foods, fresh, less additives, less dyes, because all that stuff leads to cancers, heart disease, diabetes. That's not completely a whole food. Get back to being local.
Right. A lot of people always, try to fight back and say, well, you don't know how it is to farm. And just because you farm in your backyard is way different when you farm on a large scale to feed such a big country, right? So it's like they have to do certain things to be able to grow the food, grow it fast, but also have enough yield or have enough crop to harvest, because you're fighting pests, you're fighting animals, you're fighting diseases of the land, and etc. Right? So what do you say about that?
Well, because he's a part of the president's cabinet, he will have more direct access to the overall government policies and direction that he wants to send the country in. And so it's hope that he can work and help influence policies and rules and regulations to help with those concerns.
Okay.
The other thing is that with all these different medical interventions that are out there, you got to understand what the risks and benefits are of those interventions. And that can only be done with properly designed studies.
Okay.
And that are completely transparent. And when I say the properly designed, transparent, you want to have them double-blinded, randomized, and maybe overall a suitable amount of time with the right number of people, right, having placebos in them as well. So it's got to be properly designed. Then you got to also have that all out there, but then you got to understand what are the limitations of the study, who's funding the study, and you want to make sure that any kind of policy is cited by that well-designed study. Because let's face it, of all the studies out there, there's only about 5% that are actual quality. Mm-hmm. That whole industry is also corrupt, full of money and the prestige. So that's the last thing. And between that and the studies and the food, I think that's how you will begin to get rid of or lower the chronic disease.
Okay.
All right. Second thing he wants to do was end corruption. And so how do you end corruption? Well, one thing, I think a big thing can pay off is that I believe the president can, by executive order, say that any advertising on TV from the pharmaceutical companies can no longer be. I think that would be a huge, huge thing to do. However, my goodness, it will just really shake up a lot of different industries there. That'll be a big power move, but I think it'll be a huge one. I think they got to have disclosures
Okay.
on all the different studies. Got to go when we talked about the different CDC, the FDA, the NIH. Got to go in there. New policies, new procedures, new culture. We're getting back to our mission. And if you're not on board with getting back to our mission and working for the public, adios amigos, right? And then take away all of the outside private funding that these people are getting from these agencies.
Right.
Let's stick with just a nice tight budget that's funded by the public, which
Okay.
aka our tax dollars.
Okay.
All right. But that's how I believe you really get into it. And because at the end of the day, if you have healthier foods,
Right.
right, you're more transparent with the information. That way people can make their informed decisions of how they want to eat, the medical intervention they want to take. Ultimately, though, it's all going to lead to less medical interventions, which will lead to what? Lower medical costs.
And a healthier and happier life.
That simple. It's that simple. So, I mean, it's going to be difficult from all the different policies and the philosophies you got to implement to change that culture. But at the end of the day, you really got to do what you can to restore the trust into the American public.
Yeah. Agreed.
Yeah. So, I support RFK Jr. in addressing this broken system now from the food, improving public health. I ask that you also support him.
Yeah. And before you just judge or listen to what others are saying, read up. Do your research too.
Yeah, definitely look into it. Don't just take one little source and say that's an end all be all. That's a God of
Correct.
source.
Listen to what he's saying. Read up his information on his website, what he's saying.
And who doesn't want less corruption?
Yeah.
Who
Don't
would've-
you want to be healthier?
Who wants to eat better food?
Yeah.
No, who wants to understand all the different ramifications that put in a chemical in your body?
Don't you want your children healthier?
Less disease. They want to live longer.
Yes.
Now, all these things do make sense.
Yeah.
And I'm not up for just fighting somebody just to fight because of maybe who they are, because they become a demagogue in the public eye.
Right.
So I'm going to support him, and I'm hoping for the best, and I hope he can deliver.
Right.
Now, whether he does or not, we shall see.
Right. Well,
listen, I hope you like this video. We love what we do. We love talking about health. We love promoting health, and we just love just living a life that we can enjoy and not endure.
yes.
No.
Well, until next time, be well.
All right. You take care. For more information, just look in the description below.